first step is the IPL Photofacial. We've already cleaned off the skin, prepared the skin, applied the eye protection and the gel that transmits the light. We're going to get started. Rotate to your left, please. We have our beautiful patient. We're going to make her more beautiful. Here's the cold air, okay? If it bothers you, please let us know. We can adjust it, okay? You feel it? Okay. I'll apply the laser to your right cheek. You feel that touching you? Okay, we're going to do a test spot. Close your eyes, please. Bright light. 1, 2, 3. Is that okay? Great. I'll keep going. If you want me to stop, just say stop. And I'll do 2 full passes on the entire skin. So this step is the Forever Young IPL Photofacial treatment. This one uses bright light to target the pigment in the skin. It also helps with redness and growth in capillaries. So that was one pass, and now you'll notice I'm doing the same area in a perpendicular direction. So instead of doing everything once, I do it twice using half the settings. That prevents burns. So it makes it more safe. Straighten out. Curl in your lips, please. Thank you. So after we're done with the cheek, we move on to the next area. I do the lips and the nose. Do that area twice. I'll do 2 full passes with these settings, and then I'll go a little bit more aggressive on the 3rd pass. Relax your lips and turn to your right, please. Rotate a little further, please. Thank you. Same thing on this side. How's your comfort level? No tiene dolor? No, she says no pain. Before the treatment, we applied numbing cream for about 1 hour. The nice thing about this one is it can treat pretty much all the skin types, all the different skin types. The settings can be adjusted. We have different filters that we can use. This one has various filters. It's great. You can use the different filters for different skin types. You can use it for redness, for rosacea, broken capillaries. Straighten out, please. We'll do the forehead. Thank you. Got that. You can use it for acne, for hair removal, for skin tightening. We just changed the filters for each of those things. It also has small spot size adapters, so we can treat individual spots. So that was 2 passes. I'm going to do a little bit more on the areas of particular concern. So I'm changing the filter from the 590 to the 560, and I'm changing the settings so it's a little bit stronger. Okay? A little bit stronger. A little less wet. 1, 2, 3. Is that okay? So I'll do another pass on the cheeks. And for her, I'll also do the nose. Straighten out, please. 3 on the nose. Touch your right, please. If you have questions, please ask your questions. We'll take a look and I'll answer the questions in between. So after this step, we'll clean it off and do the second step, the micro laser peel, which we will discuss in just a moment. Alright, we're done with that step. So let's switch to the other eye protection, please. How was that one? It's okay? No, we're not going to do the other one. Micro laser peel next. Not for her. Alright. So right now we're cleaning off the skin. We're removing the cold gel. The gel helps transmit the light in the first step. In the second step and the third step, there's no contact. We don't need the gel, so we're cleaning that off. Thank you to everyone who's joining us live. This will be up on Facebook after we're done. If you have questions, just type them in. If you like the video, hit the like button. We're trying to do more Facebook Live videos. If you have something you'd like to see, send us some requests and we'll do that. We're also on Instagram, A_E_skin. We have a lot of videos and photographs there. We also do a daily Snapchat. It's AE_skin. You can also follow us on Twitter and watch more videos on our YouTube channel and read my weekly blog on our website. And I answer a lot of questions on realself.com. Okay, so we're ready to move on to the second step. Okay, the next step is going to be the micro laser peel. This is going to remove a thin layer of dead skin cells from the surface. Alright. This is the handpiece. I'm going to do a small test spot in front of your right ear. Ready? 1, 2, 3. How was that? Okay, so I'll keep going. This one makes a loud noise. As you can see, you'll notice the white residue. That's the dead skin cells coming off. The micro laser peel removes the thin layer of dead skin cells from the surface, and that improves the texture. So this is great for people who have textural irregularities, any rough skin, acne, works well for acne. It's similar to a microdermabrasion, but a little bit more aggressive. This penetrates a little bit deeper. Similarly, a chemical peel can remove a thin layer of dead skin cells. The difference here is instead of applying a peeling solution and have the skin peel off after a few days, the laser just causes the skin to evaporate right in front of you. So you don't have the peeling. We're going to do the nose. So our patient is okay with a longer recovery time, so I went a little bit more aggressive on this for her. Settings I'm using is 10 microns. We're going to move to the lips. Curl in your lips, please. Thank you. 10 microns is about the thickness of a sheet of paper. So that's how much skin we're removing. It's a very thin layer. Usually I start with about half of that, but she has more recovery time, so we're going a little bit more aggressive. She'll get better results this way. So with this step, there's no bright light. It's actually an invisible light. It's an infrared light. This is called an erbium laser or erbium YAG. Okay, relax your lips. Turn to your right. Okay, step with the lip. We'll move on to the other side. The erbium laser is one of 3 lasers that are traditionally used for resurfacing, for ablative resurfacing. Ablative resurfacing means we remove a thin layer of dead skin cells. So there's the erbium, or the erbium YAG, which is what this is. There's also another version of erbium called the erbium YSGG. That's the Cutera Pearl. And then there's CO2. CO2 generates the most heat and therefore stimulates the most collagen. With darker skin types, you want to be careful not to use too much heat because it can lead to post-inflammatory hyperpigmentation or dark spots. So if we do use CO2 on darker skin types, we use more conservative settings. Alright, straight up into the forehead. So we're done with the cheeks and the nose and the lips and the chin. All we have left is the forehead. And here the scanner does pretty much everything. After this step, we're going to do the profractional therapy. The profractional therapy laser uses the exact same laser as the erbium YAG, but it has 2 important differences. As you can see in this one, the entire surface of the skin is being treated. With the profractional, we do not treat the entire surface. That's why it's called fractional. Only a fraction of the surface is going to be treated. In this case, we're going to treat about 5% of the skin. So we'll see dots where the skin is treated and the surrounding skin is intact. That allows for faster healing time. The second important difference is the depth of penetration. So as I said, with this one we're going 10 microns deep, which is the thickness of 1 sheet of paper. With the profractional, we're going to be going 100 microns deep. So that's 10 times as much, so 10 sheets of paper deep. But only treating 5% of the skin. That allows us to treat the deeper layers, and it stimulates collagen. Alright, we're done with that step. So next we're going to change the handpiece to the profractional handpiece and do that treatment. Do we have any questions yet?
No.
Will they come up? Do you have questions?
Maybe, but I don't see.
So this is the profractional handpiece. Do you have any questions? No? Okay. Okay, so I'll set the settings, 100 microns, 5%. Okay. We're going to move on to the profractional therapy. How are you feeling? Good? Okay. Again, we'll start with the test spot. In front of your right ear. Ready? 1, 2, 3. How was that? Easy? Okay. So I'll continue. Here we go. So this laser used to be Erbium YAG, like we did in the last laser, in a slightly different way. It makes tiny microscopic holes in the skin, as if you're aerating a lawn. That helps stimulate collagen. It'll tighten up the skin. It'll give a nice rejuvenation. And you can see, some people ask what this device is. So that's a zimmer that blows cold air onto the skin, and it keeps the skin comfortable. We use that for a lot of treatments. The IPL treatment and the microlaser peel, as well as Profractional therapy. We use it for fractional CO2. And I actually even use it for Botox. Most people don't use it for Botox, but I do. It's part of the painless Botox technique. So you can see the areas that have been treated with the microscopic dots and a little bit of redness, which is normal. The skin will be red and swollen for a few days after the treatment as it recovers. We do have an aftercare kit for this treatment. It consists of the Ventura Bl spray water, which contains special minerals to stimulate faster recovery of the skin, and the LFMD Intense Moisturizer, which helps keep that moisture in. So we spray a little bit of water and then apply a thin layer of the Intense Moisturizer right on top. So again, keep following us on Facebook for exclusive Facebook Live demonstrations and videos. Let us know what you'd like to see, and we'll put it on Facebook Live. We also have all of our stuff on Facebook every day. Check it out. We have pictures, videos. We put exclusive specials on our Facebook. And we're also on Instagram. If you follow us on Instagram, that's A_E_skin. We're also on Snapchat. The Snapchat is different. It's AE_skin. And on Twitter, we're AlexEMed. And you can search for us on YouTube. It's AE Skin. We have over 200 videos of different things on YouTube. I do have a weekly vlog. That's directly on our website. We talk about new treatments, answer questions. I do a daily question and answer on Snapchat and Instagram stories. It's our question of the day. If you do have questions, just send them to us and I'll answer them personally. There aren't a lot of places where you can get a direct answer from the doctor, so people like that a lot. And the other thing is I'm on realself.com, so if you go to Real Self, it's an online community where people can ask questions about various cosmetic treatments and services, and various doctors from around the world answer those questions. I answer questions every day, and I have over 1,000 questions answered. Some of our before and after pictures are up on there as well. And We do have some videos and treatments. Hot? Good. So we're done treating this cheek. We'll end the video.